Cologuard has several limitations that I think it's important to highlight and that I think patients should understand when they decide what method of colon cancer screening is best for them. First and foremost, Cologuard functions much better as a colon cancer detection strategy than it does as a colon cancer prevention strategy. It can detect colon cancers at rates similar to colonoscopy. It will detect 92% of colon cancers, while a colonoscopy will detect 95% of colon cancers. So that's comparable. The problem with Cologuard is that it's not very good at identifying precancerous polyps. And when we talk about screening and prevention, what we're really talking about is the ability to identify precancerous polyps and to remove them so that patients are less likely to develop colon cancer. Cologuard will detect only 30% of what we consider dangerous colon polyps. That means colon polyps that are large and/or have advanced precancerous changes. And if we're looking at a test as a screening test, finding something at only a 30% rate and missing 70 out of 100 of high-risk colon polyps is really not acceptable as a screening modality compared to colonoscopy, which can detect those polyps well over 90% of the time and remove them, so having the ability to alter the natural history of the disease. When Cologuards come up positive, sometimes it's a true positive and sometimes it's a false positive. It turns out that the false positive rate of Cologuard is 13%. What that means is that the patient will undergo a colonoscopy and there will be nothing found to explain why the Cologuard was positive. So I want to back up and talk a little more about the implications of a positive Cologuard. If you have a Cologuard test that's positive, by definition you go on to have a colonoscopy. That is the accepted next step. It's not considered acceptable to repeat it or to recheck it. Once it's positive, you have to have a colonoscopy. The first thing to know is that colonoscopy will not be considered a screening colonoscopy. It will be considered a diagnostic colonoscopy. And that has insurance implications for most patients with most insurance carriers in most states. What that means is that the colonoscopy will likely be paid for out of the patient's deductible rather than being fully covered as a screening modality. And I think patients need to understand that before they choose Cologuard before colonoscopy. The other is that they've now had two tests when they really only needed to have colonoscopy. Cologuard is currently recommended on an every 3-year basis, and for average risk individuals, colonoscopy is recommended on an every 10-year basis. In terms of cost, colonoscopy costs between $2,000 and $2,500, and a Cologuard costs $650. So if you're doing Cologuard 3 times as often as colonoscopy, the costs are comparable. But in terms of the quality of the screening experience and the ability to prevent colon cancer, they really don't compare.